Dr. G. Narendra Kumar, Madam Jillian Melissa, Dr. Chandrasekhar Kumar, Mr. Nicholas Osbert, Madam Metal Asdia, L.K. Atik, Mr. Amit Shukla, Mr. R.V. Karanan, Mr. V.K. Madhavan, Dr. R. Ramesh, and others who have all joined this program through their participation. Sisters and brothers, I am very pleased to join you all today to inaugurate the National Water, Sanitation and Hygiene WASH Conclave, highlighting a subject of paramount importance in our country. In many Indian languages, the word water is associated with Jivan, which means life. We often say, Jal hai, Jivan hai. Water is life. There is no life without water. This subject is very dear to my heart. As was explained, I worked as Minister for Rural Development for a while, and I have seen the need to have safe drinking water, sanitation for every village and household in the rural area, because India is vastly rural. Our forefathers saw the underlying truth behind the statement centuries ago. We have therefore for millennia worshipped life-giving rivers across the length and breadth of this vast country. The people of India, irrespective of their region and religion, they visit various rivers, they worship rivers. This is the message. The message is that let us protect our water for our own betterment. And we adore it. There's Ganga Ma, Mother Ganga. In a symbolic manner, we all agree that adequate amount of safe drinking water for every rural household is a basic necessity. Under United Nations Sustainable Development Goals, clean water and sanitation for all is a global commitment that most countries have made. In India, we have made considerable progress in providing adequate quantity to many villages. Plans are afoot to augment the supply and ensure adequate safe water for every household. This basic necessity is absolutely essential for the overall healthy living of people, both in urban as well as rural areas. Undoubtedly, there is a need to fast-track progress in this regard and bestow greater attention to all aspects relating to providing water, sanitation, and hygiene, that is, wash facilities. Importantly, we not only need to ensure water supply, but make available safe water for drinking purposes. In this context, I appreciate the initiative of Government of India and those who are all involved at various levels in this WASH campaign, including the NGOs in this gigantic mission. As a matter of fact, the significant amount of civil engineering work is involved in providing water and sanitation. The department concerned is rightly called a Public Health Engineering Department, a term which highlights the importance of public health. This is in sync with the approach that basic communities like safe drinking water and sanitation play a critical role in preventing diseases and contributing towards the overall well-being of people. Viewed from the perspective Sustainable Development Goal 6 on water and sanitation is closely related to Sustainable Development Goal 3, which is about good health and well-being. This is something unique about WASH. The progress we make in this sector has a cascading impact on many other developmental indicators of our nation. A WHO study conducted in 2018 noted that good sanitation can save more than 1 lakh lives on the annual basis, year after year. Another study has revealed that groundwater sources in villages with poor sanitation practices are, on average, 11 times more likely to be contaminated. This is a great need to create awareness on this crucial aspect among people. While Indian culture and way of life have always attached importance to observing hygienic practices, the COVID-19 pandemic ironically has brought to the fore the critical role of washing hands and observing hygiene. With sustained efforts, the COVID pandemic curve is flattering. The people should not lower their guard. They should continue with the practice of washing hands frequently, which has now become an integral part of our everyday life. It was part of our life since our forefathers have practiced it. But in between, the needed importance and focus was not made, and now the time again has come. We have to collectively work, and also we have seen the need to create more awareness among the people. In this context, I would like to stress the importance of ensuring safe water, sanitation, and hygienic practices at every school and Anganwadi centers. Children should grow up in an environment that is healthy, physically and emotionally. Preventive health care measures must begin from Anganwadis and primary schools. My dear sisters and brothers, we also need to consciously focus on responsible production and consumption and curb the habit of indiscriminate disposal of waste of any kind. Sustainable Development Goals 11 is about responsible production and consumption. And Sustainable Development Goal 12 is about sustainable communities. These two are closely interlinked. And sustainability solely depends on responsible behavior of all of us. It is our duty. ये हमारा पवित्र कर्तव्य है. इसको एक जन आंदोलन का रूप देना है तो जनता को इन विषयों के बारे में अवगत कराना है और साथ ही साथ उनको इन कार्यक्रमों में जोड़ना है. I am happy to note that the focus of this 3-day conclave is in advancing water, sanitation, hygiene at panchayats. Taking forward WASH agenda to Gram Panchayats is critical as they are the core of our rural water supply. At the same time, it is equally important to ensure institutional strengthening of the panchayats to effectively service delivery to the last mile. This is a key aspect of governance, which I always emphasize. Efficient last mile delivery of services, be it in rural water supply, healthcare services, education, agriculture, or other sectors, holds the key to fast-tracking all-round development. With the rural water supply networks getting expanded across the country, and with the plan to provide piped water supply to villages, there is bound to be a positive spin-off. There will be a huge demand for plumbers, electricians, people trained in chlorination of water, and those who can attend repairs and leakages in pipelines. Perhaps we should look at the manner in which local governments in some of the Scandinavian countries manage skill requirements at the level of countries. We can expand and apply some of these hub and spokes models as they are described, employed by Denmark, Sweden, and where possible to Indian context. In such a model, there is skilled manpower available to attend to any breakdown and maintenance works to cover many areas, including ones without such trained manpower. Providing safe drinking water and sanitation to every rural household is a massive task. Honorable Prime Minister Narendra Modi has taken this as a mission and a challenge, because given the size of this country and the varied nature of terrain, as a nation, we need to ensure that every household gets the basic facilities, the most essential of them being wash related. This can be realized if only a vast array of players join hands with singular focus and determination. In conclusion, I would like to add that I am sure this National Wash Conclave, organized by the National Institute of Rural Development and Panchayat Raj, Hyderabad, in association with the Ministry of Jal Shakti, Ministry of Panchayat Raj, UNICEF, and other development partners, will provide the much needed momentum to the WASH campaign. Wash forward, work forward. I wish the conclave a grand success. Jai Hind.